Now, U.S. health officials say the abuse of opioids, a class of drugs that include heroin and prescription painkillers, is a serious concern. They can lead to a variety of adverse health effects, including addiction. The U.S. Centers for Disease Control and Prevention says that opioids were involved in more than 28,000 deaths in 2014 in the United States. Observers say the abuse of pharmaceuticals has grown to be a major cause for concern across the globe. According to the International Narcotics Control Board, prescription drugs as a category moved up to second on the list of the most abused and trafficked types of drugs in the world. The most common types of medications abused globally were opioids, depressants, and stimulants, according to the United Nations Office on Drugs and Crime. Joining us now is Dr. George Kolodner, founder and medical director of the Kolmac Outpatient Recovery Centers here in the United States. Dr. Kolodner, welcome to Africa 54.
Thank you. Good to be here.
So prescription drug abuse, some people say it is an epidemic in the United States. What is the scope of the problem?
It's a serious problem affecting most of the states in the country, with some specific states, rural states, very severely affected. The good news is that I think there's progress in managing it, and it doesn't seem to be getting worse in the way it was over the past 10 years.
And globally, it seems also that the problem is increasing. You've seen patients coming from overseas to your clinics.
Some patients, we've seen governments come and bring delegations of doctors to look at our treatment methods, to use, particularly for heroin.
That's interesting. Now, when it comes to this issue, some people are blaming the patients, but the doctors also are being blamed.
Absolutely. These prescriptions, the pain pills, were prescribed by doctors, and there's evidence that doctors became less careful about their use since the 1990s than they had been before that.
But there have been cases where patients are asking the doctors, I need it, I want it. What is the doctor to do?
The doctor should educate the patient, not simply give the patient everything they want, but give them what the doctor thinks is a good measured balance between risks and benefits. And therefore, when it comes to particularly chronic pain, there are many alternatives to opioids.
Alternatives such as?
There are different kinds of non-pharmaceutical interventions, physical interventions. There's looking at the psychological aspects of this. And there's also managing expectations. If you tell people to expect zero pain, you get into much more complications trying to get down to that level, when people can live with low to moderate levels of pain and not get the kind of complications that you can when you try to eliminate it with opioids.
Some people take prescription drugs and don't get addicted. Other people do. Where is the line? How do some people go from just managing pain to becoming addicted?
Well, that's part of the problem, is that we can't predict who is going to become addicted to these and who is not. There's some indications if you have another addiction, then you're more prone. But because we don't know who's going to become addicted, doctors should be very cautious and use opioids not as necessarily as a first resort, but as a second or third resort when others don't succeed.
And quickly, what does it entail to address this issue? For example, in your center, what do you do?
What we do is, number one, we work on an outpatient basis. So there's a lot of focus on inpatient treatment, which can work, but it's much more expensive and much less accessible than outpatient treatment. We work particularly with people who have jobs. 75% of people who are addicted have jobs, and to have a treatment program that allows them to continue to work has great benefits.
Okay. All right, Dr. Kolodner, thank you so much for joining us today.
You're welcome. Thank you for having me.
And that was Dr. George Kolodner. He is founder and medical director of the Kolmac Outpatient Recovery Centers. Now, that's our health report for today. To stay in touch, well, find me on Twitter @Linord Moudou.